public data, how to locate and navigate through selected sites, will be presented by Taylor Olsebeck, a cancer epidemiologist with the Michigan Department of Health and Human Services. Taylor received her Bachelor of Science from the University of Michigan in Biomolecular Science and her Master's in Science in Epidemiology from Michigan State University. She began working with MDHHS as an intern with the asthma program, where she evaluated the best way to disseminate surveillance data. In 2017, she accepted a full-time position as an epidemiologist for the Cancer Genomics program, and now is the epidemiologist for the Comprehensive Cancer Control Program. While in this position for only a short time, she has co-authored a paper on evaluating the needs of cancer survivors through surveillance data and assisted in revamping the MDHHS Cancer Burden Report for the state. And lastly, she has created a cancer epidemiology website specifically for MDHHS. It is my pleasure to introduce Taylor Olsebeck.
Hi, thank you, Beth. So as Beth said, my name is Taylor Olsebeck, and I am the cancer epidemiologist here at MDHHS. And I am here today to talk about some of the publicly available data resources that are available to you. So to begin with, I'm going to go through some specific data resources that are housed at MDHHS. To begin with, the Michigan Cancer Surveillance Program. Most of you should be familiar with this program. It houses the Cancer Registry, and it sits within our Vital Statistics division. To begin with, on the left side of this screenshot, you can see plenty of other options besides cancer statistics. Some of the areas that might be of interest to this group are the mortality estimates, which would be under the vital statistics. And you can also find hospitalization data under the healthcare statistics. And then there's a health disparities tab as well. And while this doesn't focus as much on data, it does provide some of the information that our health disparities reduction and minority health section puts out, and is a good source for health disparity information. So to the cancer statistics, you can see that there are plenty of different options. You can look at incidence and mortality. There's also stage at diagnosis, and you can look at these by race, by age, by gender. One item about this site is that it only has those leading cancer sites. So you're only going to see data on breast, colorectal, lung, and prostate. But it does give you a lot of data. So as an example of what you could see from this site, if you were to click on the incidence by detailed age at diagnosis, right there, it would bring in a drop down, and you could select what you wanted to look at, and you would see a table like this pop up. So this would be a table showing all cancer incidents by age at diagnosis, and it breaks it down into 3 different age categories. If you wanted to look at a smaller age bracket, you can click on those blue hyperlinks and see a more broken down age category. So if you click there, you can go in and see some of these other age groups. One of the downfalls with this site is it is only in a data table format. So I found the easiest way to handle this data is copying and pasting it into Excel and doing what I want to with it. And it's not customizable. So what you see is what you get. And again, it's only those leading cancer sites, but it does break those leading cancer sites down by race and gender. So the Michigan Cancer Surveillance Program has a second page that is housed not on a .gov website. And this is kind of my favorite page because it is customizable. It's a query system, and you can pull out a lot of different data from it. So on that first, where this first arrow is pointing, you will see data source, and you can click on that. You'll get invasive cancer incidents, or you can look at it by all cancer incidents or mortality. You can also look at this by site, and this will have all of the anatomical sites that you would want to look at. So this is not just those leading sites. If you click on that, you'll see this pop-up come up, and there's plenty of different options. You could click on the system itself, that top header, or you can look at these more specific sites. This site you can also customize by sex and race, although for the race category, there is only data for Black and white residents posted here. At the bottom of this page, there's an export button, and you would be given the option to export either the map and the table, or just the table. And a nice feature with the map is that if you hover your cursor over the map for a specific county, it will pop up and show the county name as well as the rate for that county, in case you don't know the names of every county in Michigan. And then also on that bottom tab with the export button, there's another item you could click called state data, and you would find some age breakdowns there. However, these age breakdowns are in groups of 5 or 10. So if you wanted to look at, say, breast cancer diagnosed at the age less than 50, you would not be able to find that here, and that would be when you would go to that previous website. So we also have the behavioral risk factor surveillance system, and this is where we get a lot of our behavioral data from. So this is a national surveillance system that is through CDC, and it's a telephone survey that's representative of the state, and it collects data about the residents in Michigan on health behaviors and certain chronic conditions. And it's coordinated at the state level. So we have a page here at MDHHS. And how the BRFS is set up is there's a core portion that the CDC requires to be asked. And these questions include questions on general health, tobacco, cancer screening on the even years, and certain chronic disease prevalences. And then in addition to those core modules that the CDC administers, we also have the ability to submit state-added questions. So this is where we obtain our data on cancer survivorship, such as our data on cancer pain and clinical trials, as well as our lung cancer screening data. So if you were to go to this website, you would see this list with hyperlinks, and you can go through and look at the various different items here. The annual questionnaires are always posted. There's an annual report summarizing the data that is collected each year. And there's the standard tables that will have those core questions all broken down by certain demographics. If you click on the BRFS race and ethnicity tables, you would be taken to a page that looks like this. And you can look at the race ethnicity tables by a single year in a 4 race ethnicity group, or you can look at a combine of a couple years by a 7 race ethnicity group. The 4 race ethnicity group is going to have tables that look like this. So all those core questions on certain behaviors such as smoking will be in a PDF file, and you will see it like this. So you'll see that there's the different race categories, and then each race category is further broken down by age, gender, education, and income. If you were to have clicked on that 7 racial stratification, it separates out Arab as well as Asian Pacific Islander from that other category. So some of the cons with this page is that these tables are static. You're opening up PDF files. You can do a control find, but they are static, so you're going to be clicking through pages and searching through PDFs. And also only the core questions that CDC requires us to ask is posted online. So those data that are collected on survivorship and lung cancer screening would not be found on this page. So we also have the Michigan Open Data Portal. A pro of this is there's a lot of data here, but that could also be a con because there is a lot of data here. But it is customizable. It has nice data visualization ability, and it has data for not just MDHHS, but all of the Michigan departments. The areas that would probably be most interesting for this group would be the data portal as well as the GIS open data source. If you click on that open data portal where the arrow's pointing, you will be taken to this page, and it has various different information on different types of data. If you click on that DTMB icon at the bottom, it actually brings up some information on socioeconomic status factors, such as income, employment, and wages for the state. So that could be of interest, as well as this health icon. So by clicking there, you would be taken to the open portal where it has a list of different open data tables available to you. A lot of these are going to be the annual community measures. So these are the state report cards. And if you were to click on that, you would see what is collected for the annual report card. So some of the items in that report card are the number of people served by Meals on Wheels, people receiving routine checkups, lead screening in children, obesity rates, as well as drug overdoses. If you go back to that main landing page, you can click on the GIS Open Data. And for GIS users, this is a good spot to pull your shapefiles in. And this can be beneficial because you'll have these pre-made shapefiles to pull into your software, such as legislation districts or school districts. For general public who's not wanting to do that, they have interesting applications within this portal. So if you click on the public health icon, you'll be taken to a page that looks like this. A lot of these data sources are going to be on wells and wells locations. But for this group, what might be interesting is if you go up to that top right corner, it says Apps and Maps, click on that, and then you'll see this come up. And this is done by our Department of Licensing and Regulatory Affairs, or LARA, and it has a map of various different healthcare facilities. So they take the licenses for hospitals, for hospice agencies, long-term care facilities, and you can toggle the filters on that right side of the page and see where those are located throughout the state. So this is a somewhat new type of application. So they are looking to add additional information on top of the healthcare filter. One topic I know they are trying to do is finding the location of where the liquor licenses are throughout the state. So I expect more data in addition to the healthcare filters, will be added eventually. So those are some of the Michigan-specific resources, but there's also plenty of national resources that have data specific to Michigan, as well as specific to some of the health equity social determinants that we are interested in at the MCC. So Centers for Disease Control, or CDC, has a very nice data visualization page, and you can go through, you can see how Michigan compares to the different states. You can select different cancer types. You can look at it by male or female. And it also has demographic information here. You can look at different cancer trends for incidence as well as mortality. You can look at how Michigan compares nationally, and you can also click to the state and county tab to pull up Michigan-specific data. So the state county tab is the fourth one over, and it would pull up something that looks like this. So this is the one for Michigan. You'll see a nice little Michigan map, as well as rates for men, male and female, race, and then race by sex. And you'll see here we have the expanded race categories. So there's American Indian included, as well as Asian and Hispanic. So this will have data similar to that Michigan Cancer Registry page. However, usually the Cancer Registry page housed on the Michigan site is updated sooner than the CDC site. So if you want the most up-to-date data, you would want to check with the Cancer Registry first here. However, the CDC did just update this page, so they are on the same year at the moment. And if you were to compare the rates between the Cancer Registry page and this page, you're going to notice a slight difference. And that is due to methodology change, but doesn't make one wrong and one right. both are quality data that you can use. Also, under the CDC is this application called CDC Wonder. And this, again, is going to be a lot of data. And it has a lot of data in addition to cancer. So if you're interested in different mortality causes of death, you can look by ICD-10 codes, and you can compare different diseases and leading causes by different races, different genders, etc. If you wanted to look at the cancer statistics specifically, this is a query system. So you would click on that cancer statistic up at the top. It's the third one down. And you would be brought to a page like this. You would go through, select what you want to look at. You can group results by the items that are listed here. You can look at it by state or by cancer site, year, age group, sex, ethnicity, race. And you would click, choose what you want to look at. And this is the bottom half of that same page. For what I decided to look at for the sake of this was to look at all leading invasive cancer sites by ethnicity and race among all age groups and all sexes. So it would process the data request, and it will bring something up that looks like this. So it has the leading sites by ethnicity, by race, and you can see which cancers by race and ethnicity have the highest incidence rates. So for this example, you'll see prostate cancer among non-Hispanic African Americans is our highest cancer in Michigan. And you can look at this for other states. You can compare different states as well as look at it at a national level. And one of the things I like about this page is you can select your own age group. So if you wanted to look at a very specific age bracket, you can come here and customize that age bracket so you can get the data that you want. And this is easily exportable. So if you go to the bottom of the data table, you can export it out into an Excel sheet, and you can take the data and do whatever you want with it. So now there's SEER, and while this is not necessarily specific to Michigan, this is our good source for survival rates. The survival rates have not been published on the Michigan Cancer Registry website since 2010. So this is our, this really is our best source for the survival rates for different cancers. And so we usually take our survival rates at a national level. There's various different query systems and areas where you can look for data here. So this bottom arrow is showing you the cancer query systems. If you click on that, you will be taken to this page. And there's several different items here. What is of interest to me specifically is the SEER survival statistics. Clicking on that will take you to a query system, and you can select what you want to look at. So you can look at the different sites. You can look at year of diagnosis, race. For race, there is only white and black, and sex and age at diagnosis, as well as survival interval. And sometimes it's hard to get survival data that's not just 5-year survival. So this is a nice area to go to if you want to look at 1-year survival rates or 10-year survival rates instead. If you don't want to go through a query system and have a table and decide what you want through that, you can go to Cancer Stat Facts. And this section provides a nice little summary of the different statistics for certain cancer sites. So if you click on that, it will bring up a list of specific cancer sites, and you'll get something that looks like this. So this summary is specific to lung cancer, but you'll have a nice little chart and some data visualization, and it goes through after this little at a glance. There's some more information lower on this page that you could see incidence and mortality. There's also the National Cancer Institute, and this has a lot of the same information that you would find on the CDC page. So there's population demographics as well as the screening and risk factors. Those screening and risk factors come from the BRFS, So you could also find that same data on the BRFS website. Cancer knowledge is an interesting topic. However, they have not updated that data in about 10 years. And there's incidence, prevalence, and mortality. Something that's unique to the National Cancer Institute page is if you click on incidence, it will give you different options on how to look at incidence. And one of those options is to look at the 5-year rate of change. So this, I think, is a good source, especially since this is unique compared to some of the other sites. You can look at these changes in certain cancers over the last 5 years, and this will bring up a little query system. So for this example, I had chosen to look specifically at cancers that have increased among Black men. So then you can look and see that, well, pancreatic cancer has increased by 4.4% over the last 5 years, and see some of the cancers that have been on the decline. So one of the negatives about this page is this page isn't usually as up to date as what we have at the state level, especially with the BRFS data. The BRFS data is out of date, as well as that cancer knowledge data is definitely out of date. But it does have some nice graphic displays, and you can look again, state versus national. So these sources I've been talking about have really focused just on cancer and disparities within cancer. However, there's a lot of other sources out there that don't necessarily look at cancer, but look at disparities and social determinants of health. So that's what the rest of this presentation is going to be on. And so previously I showed the BRFS page specific to Michigan, and this is the CDC page. It has some better data visualization than our Michigan page does, and it's usually up to date, and it will have the more recent year quicker than our state page does, and you can compare Michigan to a national to the national level. You'll see that there's various different indicators on that right side topic, right side drop down, and you can look at it by topic. If you were to click one of those topics, say e-cigarette use, it will bring up a map that looks like this. It will show that it is displaying data from 2017, and it's looking at current e-cigarette users, and it's the age-adjusted prevalence. And you will see it's broken down by quantiles. Michigan is in the highest quantile for this particular indicator, and it gives a nice comparison to the rest of the country. If you wanted to look at this by a bar chart or by a table, those options are available to you as well in the upper right-hand corner of this screenshot. Another page that is from the CDC, it looks very similar to the previous page, but this is for the Disability and Health Data System. And for this page, you can look at the risk factors by disability types, as well as just if someone is reporting a disability or not. And so again, you can go to the right-hand side, select the different types of data that you would want to look at, or you could click on a state to look at state-specific measures. So for example, I had looked at chronic conditions, ever had cancer, and you will see this map show up. It's looking at disability status. So this is the percent of people reporting any disability, and you're looking at it from the national level. Again, Michigan is in this higher quantile for this specific measure. If you wanted to look at some more detailed information on this site, that is available to you. So if you were to click the Michigan icon, you could look at some Michigan-specific data. At the top of this screenshot, you'll have the location, which is set to Michigan, and you can select which category you would like to look at. So I selected health risk behaviors, and what comes up are some of the health risk behavior indicators, such as BMI and smoking status. And this is showing any disability versus no disability among Michigan residents. And you can see the difference in BMI status as well as smoking status. If you wanted to look at these indicators by disability type, that's also available. If you just click on the view by, you can select disability type instead of disability status. So the disability types include vision disability, a hearing disability, a cognitive disability, or a mobility disability. And then there's the American Community Survey, which is a very good source for social determinants of health data. Most people are aware of the census, which is done every 10 years, but less people know about the American Community Survey, and this is done yearly. And this survey is representative of the US, and it contains a lot of different information on demographic information as well as social determinants of health. So it's similar to the census. It's done every year, and there's some additional questions that are asked on the American Community Survey that are not asked on the census. But this is really helpful because it fills in the gap in data between decades when the census is done. So they just updated their page, and I haven't found the time to navigate through the new page, but there's the different subjects here, and you can look at what type of subject you want to look at. So there's different items such as housing, income and poverty, and you can look at a lot of these things by race, by income, by ethnicity. If you click through these, you're going to get a lot of data tables. So under these subjects, you're going to get a data table. You're going to select what type of data table you want, whether it's poverty by age, and then you're going to pull up this big table, and it can be kind of overwhelming. So an example of one of those tables is this. So this is looking at, specifically in Michigan, the amount of people who speak a language other than English when at home. So it shows about 10% of Michiganders speak a language other than English at home. And then it has a lot of different data broken down by the various different demographic information, such as age. The American Community Survey does ask about citizenship, so it does have this broken down by people who were native versus foreign born, and if they were a naturalized citizen versus not a U.S. citizen, as well as poverty status, education attainment, and those other demographic factors that you would find in the census. So again, there's a lot of information here, and it's a good source, but sometimes it's hard to navigate and find the exact tables that you want to find on this survey. The U.S. Census also has some more user-friendly data visualization tools that are available to the public. And so this would be the site you could go to get to a lot of the GIS mapping programs to look at items. These are mostly by county, but the American Community Survey does release data down to the census tract. So on the last slide, when we're looking at language spoken at home, we could have pulled that by census tract, and it could be a good source if you wanted to look really specific at your community. Some of the interesting mapping tools they have on this page, if you look at the bottom row, you'll see the SAHI interactive data tool. This is looking at health insurance coverage, and that is by county, and you can look at that across the United States. And then there's also the SAPI interactive data tool, which is looking at poverty rates across the United States. And something interesting about the poverty tool is that it breaks it down by school district, so that could be of interest to some. Again, there's a lot of data. There's a lot of different tools here. It'll take a little bit of time to find exactly what you want, but there's a lot of good quality data available on the U.S. Census page. So summarize these sources. For the most part, the Michigan resources are going to be more current than what is at the national level, especially when it comes to the cancer registry data. However, most of the Michigan resources are static, static tables. The software is not as pretty as like the CDC software is, and it's mostly going to be PDF downloads, copying and pasting numbers out of a data table. However, because these people are at Michigan and the people who are controlling the data are sitting here, they tend to be a little easier to contact than going to the national level. The national resources are usually going to have nicer looking software that is prettier and it's a little bit more customizable. So I'm going to give a plug-in for myself. We created the MDHHS cancer epidemiology page. If you go to michigan.gov/chronic-epi, you will be brought to this page. And these are all of our chronic disease epi programs that we have currently. The cancer epidemiology page is at the top. And so if you click on the survivorship tree, you will be taken to this page, and you'll have different drop-down menu items that you can select through. And this page just went live a few weeks ago, so we're still in the process of uploading the data onto this page. However, this could be beneficial to some who don't want to go through 10 different websites to pull information on, for example, breast cancer. We have already done that for you. You can go pull the fact sheets down from this page and look at mortality, incidence, survival rates, stage at diagnosis, disparities within breast cancer, disparities within mammography services. Those are going to be here. On the screenshot, you can see only oral cancer is highlighted in blue. That's the only one uploaded right now, but the others should be coming soon. Also, I want to highlight under reports, there will be soon a cancer atlas, and that is going to have a lot of that social determinants of health data that I talked about under the American Community Survey. So a lot of that is, a lot of those social determinants of health are pulled into the atlas and mapped by county for the state of Michigan. So that is of interest for anyone. It will be uploaded shortly. And then, because we have some additional time, there's some other data resources that I did not go over because they're really specific, but they are of interest, especially to a group of people focused on cancer and health equity. So this first site is the Michigan Immunization Report Card. This is put out by MICR. It's put out quarterly, and this is a good place to find the HPV vaccination rates. It is done at a state level as well as a county level. If you go to that website, you can look at the HPV vaccination rates by county as well as the other vaccination rates for the state. The Michigan Viral Hepatitis Program puts out an annual report on hepatitis B and C burden in the state, and it also has some data specific to liver cancer that is included in that annual report. So both of those are michigan.gov pages. The next one is kind of an interesting page. It's very, very specific, but it's Map the Meal Gap. It's from the USDA, and it provides estimates for food insecurity in the U.S. And you can look at it specific for Michigan and down to the county level. So if you go to that website, you can see the counties and the states that are having issues with food deserts as well as food insecurity. And there's some information there on SNAP benefits and recipients of certain benefits to address food insecurity in the country. The Youth Risk Behavior Survey is also a good source of data. It is similar to the Behavioral Risk Factor Survey, but it's among youth. It's given to students in school, and it provides behavior estimates for high school age kids. And an interesting thing about the YRBS is that it does include sexual identity as a demographic. So you'll notice most of these previous pages, or I should say all of the previous pages, do not have LGBT as a demographic. It doesn't discuss if the demographic of belonging to the LGBT community. The YRBS does. You can look at data comparing straight versus gay or lesbian students, and it provides a lot of good insight when looking at the disparities within this specific community among the youth. So, for example, you could look at smoking rates, and the YRBS shows that about 8% of straight students are current smokers, compared to 42% of students who report they are gay or lesbian. And then on that same topic, there's the LGBT data and demographic page that is housed with UCLA, and this provides estimates of the LGBT population. It doesn't cover behavioral risk factors among this population or cancer-specific data, but it gives an overall estimate of who makes up this population and where are they at. And then lastly, I didn't talk about the American Cancer Society, but they have a page as well, and they have a Cancer Statistics Center, and you can go to that page, and it provides summary data on various different cancers. So you can get a nice summary of the incidence, mortality, and the leading cancers. It compares cancers. You can look at it by cancer type, or also you can look at it by state. If you look at it by state, you'll see what cancers are the largest burden for our state. And that is all I have. So if there's any questions, I can answer them.
I don't see any there yet, Taylor, but I know people are interested. So let's give them a little bit to get it typed in. So our first question is from Kevin. Says, thank you, Taylor. Very informative. Any ideas on how to get raw data from these sites?
So the best way to get raw data is I have the contact information of the data stewards for the BRFS as well as Cancer Registry. That would be your first step to get raw data for those specific sources. MDHHS does have an extensive data sharing agreement process, so be warned. For these other sites, SEER also has a quite extensive process to get raw data, but it is possible. And then I think those are really the only ones that would make sense to get raw data from. Yeah, hopefully that answers your question.
Thank you, Taylor. This is Beth. We have another question. Hello, and thank you for the information. How is the annual survey done? Is it mailed to homes, given at doctor's offices?
Is the annual survey you're talking about the BRFS? If it is, the BRFS is done through phone, and it's a random sample through the state. And it's not through doctor's offices. The American Community Survey, it's not like the census. It's not going door to door, I believe, and I'm not sure of the answer for the American Community Survey.
Yes, that's the information that they were requesting. Thank you, Taylor. Are there any other questions today? Looks like there's a couple more people writing questions. So here's a question. Dr. Wu was looking for data on limited English proficiency in uninsured Asian Americans by the subgroups, for example. Hold on, this is a little bit harder to scroll through. Taylor, I'm going to assign it to you so you might be able to read it easier. There's a couple of questions there.
To answer that question, that you would want to look at the American Community Survey. That would be a good source for you. The American Community Survey does break down race more extensively than some of these other sources, so that would be a source to find data specific to Vietnamese as well as Chinese. It also will have it by poverty status, and what I forgot what the first part of that was.
We're doing a formatting change here to try to help with that.
So yeah, the American Community Survey will have that information for you for looking at these specific demographic groups and looking at insurance status, poverty, education attainment, housing. There's English speaking and non-English speaker, and I believe the American Community Survey does stratify non-English speaking by if they're proficient in English or if they speak barely any English. So all of those items should be found in the American Community Survey. It might take some digging to find the tables that you're looking for, but it is there.
So here's another question, and Dr. Wu says, thank you, Taylor. And another question from Megan. I know Michigan is one of relatively few states that collects sexual orientation on the BRFSS, but it is not published. What is the best way to obtain this information?
Yes, so it's currently not published. I believe they're trying to make strides to have it considered as a demographic variable to get published in the future under those stratifications by demographics. Again, if you have a very specific question that you need answered stratified by sexual orientation, you can reach out to the data steward that I had listed on my slide. Her information is also on the BRFS website, and she would be able to get you that data. And there is some LGBT data on that cancer epidemiology page for MDHHS. If you look at the cancer burden report, which is under the report tab, we have a 2-page section on LGBT health and some of the risk factors associated within that community and comparing it to people not in that community. If you want to look at LGBT data for cancer incidence and mortality, it doesn't exist. So you're going to want to look at the behavioral data. And if the data is not already on the cancer epidemiology page, you can contact the BRFS coordinator directly. If you go to the chronic, I see some questions about the chronic epi site. So the chronic epi site, I use that site because it has a marketing URL and it's easy to remember. If you go to that site and scroll down, the cancer epidemiology page is the survivorship tree. So it's on the top middle. And if you click on that, it will take you to a page that has specific data on cancer epidemiology. And you'll see that there's a report tab, a fact sheet tab, some presentations, and then there's also another tab that says other sources of cancer-related statistics. And a lot of the websites that I talked about just now is under that tab.
So I'm not seeing any more questions. Comment from Kevin is keep up the good work.
Thank you.
So on behalf of the MCC Health Equity Committee, I would like to thank everyone for joining us today. We will be offering another webinar in the fall. The topic and time has not yet been determined, but I'd like to give a special thank you to Taylor for preparing this wonderful presentation for us today, and hope that we will see all of you again in the fall. And I will be sending out the link to all the registered participants for the web version of this recording as soon as it's available. So thank you all for joining us today.